Joining us today. Okay, we'll kick off here. We have some others joining us, and they'll catch up with us. But good afternoon, everybody. Thank you so much for joining us for our office hours sessions today. We are going to be covering two of the federal nutrition programs that affect or that are available to grandfamilies and kinship families. One of them is WIC, and the other one is CAC. I'll just say CACFP. I will tell you what those mean in a second. But as you all know, food and nutrition programs are just often a lifeline for kinship and grand families. And so we are honored to be able to have the Food Research and Action Center as one of our subject matter experts. And if I don't know if you've all been part of our series, but this is the last in a series that we've been co-hosting with FRAC, which we're calling Office Hours. This is not really so much a webinar format as it really is more of an interactive conversational format. We want to kind of hear from you about how you're using these programs and those families that you're serving, and also to allow you to ask some more detailed questions because some of these programs are pretty complex and trying to figure out eligibility and how you apply and what the programs actually offer can get very confusing sometimes. So fortunately, we have two experts with us today on these two federal nutrition programs, and I will be turning it over to them in a minute. I just want to invite you all, if you want to put your cameras on, you don't have to, but we really want this to be more of an interactive conversation. Our presenters will just share some general information about the two programs, ask you all some questions about your experiences with these and other food and nutrition programs, and then also give you some time to ask questions as well. So today we have with us Clarissa Hayes, and Clarissa is a deputy director of the child nutrition programs and policy, and she's going to cover the child and adult care food program. And then we also have with us today Susan Beaudoin, who is our senior program manager at FRAC, and she's going to be talking about the WIC program. And so I will turn it over now to Susan.
Thank you, Melissa. Hi, everyone. It's so great to be with you today. It's always nice to see where folks are coming from, so we'd love you to drop in the chat. Just some key details, your name, your affiliation if you have one, and what state you're joining us from. So as Melissa mentioned, I'm Susan Beaudoin, Senior Program Manager focused on WIC with the Food Research and Action Center, and Clarissa Hayes, my colleague, is the Deputy Director for Child Nutrition Programs with FRAC, and we'll be focused on some key early childhood programs today. In case anyone isn't familiar, the Food Research and Action Center, or FRAC, works to improve nutrition, health, and well-being among people struggling against poverty-related hunger in the U.S., and we do that through strategies like advocacy, partnership, and by advancing bold and equitable policy solutions. You can learn more about our work at our website, frac.org. Now I'll hand it over to Clarissa to walk you through CACFP.
Amazing. Thank you, Susan. And hi, everyone. It's so great to be here with you today. I know Susan has shared that this is just a fantastic network to work with, so very excited to be chatting about these programs today. And Melissa, I just want to say that even after years of working on CACFP, I still stumble over that name all the time, so we'll get through it together. But where we wanted to start is, since Susan and I today will be covering two programs that really reach the youngest kids with nutrition, we thought it would be important to kind of set the scene for why these programs are important and why this age range specifically is so important. So on the next slide, We just really wanted to reiterate that there is plenty of research out there right now that really shows that good nutrition during pregnancy and during those early childhood years really helps to build the foundation for healthy brain development, learning, and lifelong health. And really, so much of a child's physical and brain development is happening from prenatal to 5, which really makes WIC and CACFP so critical. We also know with our experience with the federal nutrition programs and the research that exists that these really can help create a positive and long-term outcomes for children. So expanding access to WIC and CACFP and reaching these children at this age range will just have huge impacts on these children as they go to kindergarten and beyond. So, with that said, and that kind of level setting, I wanted to dive into the Child and Adult Care Food Program. So, CACFP is one of our key federal nutrition programs that we work on at FRAC. And I would say it's a little bit under the radar, a little underutilized. So, if you haven't heard of it before, that is okay. We'll get through it together. So, how this program works is basically at its core, it reimburses childcare settings for serving nutritious meals and snacks. So, a really easy way to think about this is if you are familiar with school lunch or school breakfast, you know that the federal government has these programs, has this funding, and then it gets disseminated through the state to these different settings. So, you have breakfast and you have lunch, and then you have the CACFP, which works specifically in those early childcare settings. So, think about like family childcare homes, childcare centers, Head Start and early Head Start. And then there also are some components around like after school programs, emergency shelters, and adult care centers. We're not going to get into that because this program is pretty broad. We're going to focus really on the early years and early nutrition. But really at its core is this program exists to reimburse those providers who are serving healthy meals at childcare centers and family childcare homes. And how it works, again, is these settings receive a reimbursement from their state agency who is getting that funding from USDA to serve meals to the children that are in their care. And on an average day in the last fiscal year, this program was reaching over 4.4 million participants nationwide on an average day, which is really great. But again, when we look at the whole number of who is eligible and the number of child care centers and child care homes, we do know that more settings could be participating in this program, and they're missing out on a lot of great benefits here, which I have detailed on the next slide. So, out of all the federal nutrition programs, CACFP has actually had quite a bit of dedicated research to it, which is amazing. And we know the benefits of this program. So, the first, like I've already talked about, is just the health benefits. We know that CACFP is really key to ensuring children are receiving those nutritious meals and snacks. It's reducing food insecurity, promoting healthy growth, and then helping to boost learning and development. And then on the economic side, we know that this is a win-win here as well, right? So we know families and kinship networks or families have to put the children into care for the most part. So this is helping families' ability to work. It's supporting jobs in childcare, being able to bring down that reimbursement instead of having to use some of their budget funding for meals, they can use this federal reimbursement to cover the cost of it instead. We know that it can help support local economies by, having that funding go out the door then to purchase those meals. And then it just at its core is making sure that childcare is more affordable for families with low incomes. They don't need to worry about packing a meal, a breakfast and a lunch. They don't need to worry about the extra cost of paying the childcare center or home for meals because they're being covered through this other program. And then the next component here, and the next pillar that's really important, is it supports the childcare centers and settings. So it's helping to stabilize childcare, strengthening the quality of early childcare. And then a lot of folks look to these providers who are doing meals as a quality indicator. So that's another key piece to think about. So now that we know the benefits of CACFP, if you want to go to the next slide, and this is a little busy of an illustration, but the other really wonderful thing about CACFP is that similar to school breakfast and school lunch, all of the meals that are served through this have to meet federal nutrition standards. So this really, ensures that children are getting the healthiest meals that they need. So on here are some examples of what the framework of CACFP aligned meals and snacks look like in practice. And the great thing about this is that they obviously are changed depending on age. We know a 1-year-old needs very different food intake than a 4-year-old. And at its core, similar again to breakfast and lunch, it leans into milk, fruits and vegetables, whole grains, and proteins. So I think the other key piece of this is that families, kinship families who are taking care of children, they know that their child through this program is really getting healthy options and again takes away some of that concern around having to pack meals or cover that cost. So, helping support families' budgets and the childcare settings as well. Next slide, please. So, the most important piece is how can kinship and grandfamilies access CACFP? So, CACFP meals are typically available to children who are attending, like I said already, child care centers, family child care homes, Head Start, or Early Head Start. And the thing that makes CACFP a little bit trickier than some programs is that you are not applying for it and then receiving it, and then you know for sure that your center or your childcare home is participating. A lot of times, facilities that participate actually, they are required to not add an extra fee or a separate charge or, indicate on your like overall childcare tuition that CACFP is included there. Food can't be billed as like an independent extra cost through this program. So you may be sending a child to a home or a daycare and they are just getting meals and you're not quite sure like is this included in the tuition, is this another program? So really, the sign here is to reach out to your center and your the home. If they're not doing meals, you can talk to them about CACFP. If they are serving meals but you're not quite sure if they're doing it through this program, you could even reach out to them and ask them that, because if they aren't, then getting more familiar with CACFP and taking this on could really help to boost their budget as well. So I would say, some of the key takeaways here are to make sure that you're referring families to CACFP participating providers if you can. We know that switching or going to certain childcare settings isn't always possible if there's not a lot of supply. So obviously keeping that in mind, helping to connect childcare providers to CACFP, including information about this and any resources that you're giving to caregivers, and then just helping to eliminate any questions or concerns that folks may have about this program. So again, it's a little bit different than WIC, which I know Susan will talk about. It's not as like intentional as a registration process, but really at the end of the day, if centers and family child care homes are participating in this program, it's a win-win for families, the providers, and the local economy. So I think that is it for my piece on the background of CACFP. I wanted to just pose a couple of questions to you, and I'm hoping my animations work here if you want to click one more time. So what I'll do is I have a couple of questions and I will just run through these. I would love if you want to come off mute and answer, or if you want to answer in the chat, that would be great. But I am wondering if you are surprised to learn that there is federal funding available to help provide meals and snacks in childcare settings. Is this the first time that you've heard about it? Are you familiar with it? Have you been advertising it to the families that you work with? And I'm going to scroll down into the chat. Okay, so I already see a yes, I am. Well, great. I'm glad we could share a little bit more about CACFP today. So yes, just wanted to get a gauge of everyone's familiarity with the program. If you want to go to the next bullet, please. So I'm curious, CACFP again is a little bit different of a process, but what do you think kinship and grandfamilies need or want to know before taking a child to a CACFP meal site? What information would be most helpful to share with them to help eliminate any concerns or barriers with the program? And selfishly, I think this feedback is also helpful for me and Susan, who can take this and use it in our own resources and guidance that we provide. All right, still awesome. People are just getting familiar with CACFP. All right. Well, I'll give folks a little bit of time to think about if you have any feedback on this question. And then I think my last question for everyone is based off this, which I know for those who are new to CACFP, it is, a lot of information, but what would you need to feel comfortable explaining CACFP to a caregiver? Do you feel like you could take this and share this? Are there any other questions or concerns that you have? Happy to answer those. All right. Is the food program inclusive to special dietary needs? So I will need to confirm this. My understanding is that it is not a requirement that that happens, but it is a best practice. And I do think that most childcare settings aim to do that. Okay, perfect. And then, yes, so literature about the program, and then flyers or informational resources in Spanish and potentially other languages. So that is something that we often hear is needed. And I know USDA with their resources have made efforts to translate those. And then as well, I mentioned this earlier, but in each state, again, you think about the federal government funds them, and in every state, there is an agency that does the training and spreads the word about this. And many of them do have materials that are translated into other languages. All right. Well, I hope everyone, I'm going to go ahead and grab these questions. I'll put them in the chat so people can keep thinking about them, and happy to answer some more questions at the end if you want to circle back to CACFP. But just in the interest of time, I think I will go ahead and turn it over to Susan to shift gears a little bit and talk about WIC.
Thank you, Clarissa. All right, so on to the Special Supplemental Nutrition Program for Women, Infants, and Children. You'll mostly hear this as just WIC. And I liked how Clarissa was talking about CACFP is similar to school meals. For WIC, it's more, you can think about it as more similar to SNAP, and then an individual applies versus an entity providing the meals through the federal funding. All right, so WIC's a federal nutrition program, and it provides pregnant and postpartum individuals, infants, and then children up to age 5 with nutritious foods, education and counseling, and referrals to healthcare and social services. And this program, I'll talk a little bit more in detail about the eligibility for it, but just so you know, it's targeted to folks in households with low income who are deemed to be nutritionally at risk, which I'll explain that jargony piece as well. And in fiscal year 2025, WIC served more than 6.8 million people around the country. Next slide. Right. So eligibility is based on 4 categories. First up is the participant category. So this is whether the person applying is pregnant, postpartum, and that can either be up to 6 months after the birth if they're not breastfeeding, or up to 1 year after birth if they are breastfeeding, an infant, or a child up to 5 years old. For infants and children, caregivers, including grandparents, kin caregivers, or foster parents, can apply for WIC on behalf of the child. And also, it's great to keep in mind if you have a kinship family where, say, for example, an aunt has taken on care of her 3-year-old niece, and the aunt also happens to be pregnant. She can apply for WIC for herself, for benefits, as well as for that niece. Another important thing around eligibility for WIC is that there's no test related to citizenship or immigration status at the national level. There's only one state where there are considerations around that. All right. Oh, there we go. Thank you. Criteria 2 is around income. So household income at or below 185% of the federal poverty level, or if the person use a mechanism called adjunctive eligibility. That just means that if they're already participating in Medicaid, SNAP, or TANF, and in a couple of states, Head Start is thrown into the mix for that. If they're already participating in one of those programs, they're considered automatically income eligible for WIC. So they don't have to, again, provide that documentation showing the income eligibility. They can just say, hey, here's my WIC or my Medicaid card, working with the agency to make sure they're showing whatever documentation on that they need to show. And what's key to know about that is it helps streamline the process for the applicant and for the WIC agency. Third is nutrition risk. So that could be something like a medically based risk, like anemia, or it could be a diet-based risk, such as inadequate dietary pattern. And that's determined by a health professional. Often that's going to be a staffer at a WIC clinic. And it's really rare for someone who's otherwise eligible for WIC to not meet that nutrition risk requirement. And then just finally making sure that the person's applying in the correct place. So you want to apply within your state, and you'll be able to find that information, and we'll talk a little bit later about connecting with your local WIC agency. Next slide, please. All right, so as I mentioned before, there's a great list of different services WIC provides: nutritious foods, breastfeeding support, nutrition education that's tailored to the life and nutritional needs, as well as screening and referrals to other health and social service programs. So really nice wraparound pieces there. And WIC services are provided by qualified professionals such as registered dietitians. Next slide, please. All right, zeroing in on that nutritious foods component. So WIC provides supplemental foods that are designed to address the specific nutritional needs of participants. These are provided via a monthly food package benefit for one of 7 science-based food packages, and the specific package is going to be assigned to a participant based on their life stage and their nutritional needs, and the WIC agency staffers will work with the person to figure out which one is right for them. And these involve a host of foods like eggs, whole grains, beans, milk, and much, much more. You can see here an example from Michigan WIC, some of the WIC food packages foods. And so in terms of how that food package works, WIC guarantees a specific amount of each WIC food each month. So for example, a dozen eggs might be in the food package for that person. The one exception there is the fruit and vegetable benefit, and that has a separate cash value. So participants are able to use that to pick the fruits and vegetables that make sense for them. And that cash value benefit for fruits and vegetables for children, I'll just highlight that one, it's $26 per month. And then there's additional amounts available for the adult participants, going up to about $52. And for infants, there's also WIC food components with formula, so that can be really helpful for grandfamilies or kinship families who are caring for a young child who needs formula or specialty formula. And these food package benefits are loaded onto an EBT card. You can see that there's a little California example there. It works like a debit card at grocery stores who are approved WIC vendors in the area. And these food packages for WIC were just updated through a 2024 rule, and they made a host of improvements, and those improved food packages are now implemented across the country. Next slide, please. And a strong body of research shows the importance of WIC for participants and for communities. And just one example of that, WIC's been shown to improve dietary outcomes for participants. And you can see a lot more about the research behind that. There's a piece linked here, so when you get the slides in the follow-up, you can check out that resource if you're interested. Next slide, please. Right. Despite all of these benefits, there is a large gap in the number of people who are eligible for WIC versus the number who are participating in the program. So the latest data we have on that across the country is from 2023. This is USDA data and MAP, and only 56% nationally of eligible people participate in WIC. So that means there's millions of eligible women, infants, and children around the country who are missing out on the program benefits. And you can see state to state there is a big difference in that coverage rate. With the darker states have the higher coverage rate, so more eligible people are participating, and then the lighter states on the map, fewer eligible people are participating. And we do nationally see a big drop off once kids hit about 1, and then for older children who are eligible in the program. So that age 1 up to age 5, we see lower participation rates than we do for infants in the program. So especially great to be communicating to the families you are working with if they have kids who are up to age 5. Like, this could be a really great resource to make sure they're aware of, since a lot of times people think of WIC as something just for little babies. Slide 17, please. Oops, next slide. Thank you. All right, and caregivers, as I mentioned before, can apply for WIC for the children and infants in their care, and you apply for WIC through your local WIC agency. Your state's WIC agency can help you find your local WIC agency and information on how to apply. And I say state agency, that includes like state health departments often run WIC programs, or Indian tribal organizations in some areas run WIC programs as well. So you can check out, USDA has a list, you can help figure out where your specific state agency and local agency are. And then USDA also has available a pre-screening tool that folks can use to see if they might be eligible for WIC, if there's interest in doing that before contacting the local agency. Although it's always great if you think a family may be eligible, for them to connect with their local WIC agency. And some states have additional tools, their own pre-screenings, or a starting app form. All right, next slide, please. All right, and we have FRAC developed a few years ago for the Grandfamilies and Kinship Support Network, a resource specifically focused on kinship and grandfamilies and WIC. So this provides a little bit more information on the program. You can use that as a flyer to educate your staff, your partners, the families you work with about WIC, with a little bit of additional information around the program for grandfamilies. All right, next slide, please. Okay, I also have some discussion questions for you. Also wanted to show you this great graphic from Hunger Solutions New York. They partnered with the state WIC agency to do some outreach campaigns a couple of years ago. And I love, you can check out the link, their materials. They have a whole host of them that are targeted to different caregivers, as well as a bunch of families with dedicated information. So I always love to do a shout out to that, since it makes me happy. And it's really important to see those additional caregivers represented for WIC. All right, click please, thank you. So I'm curious, like Clarissa, I want to learn a bit more about your interactions with WIC and use you as a brain trust for additional pieces that would be helpful. So has anyone here referred families you work with to WIC? And you can drop it in the chat, or also feel free, I think everyone should be able to come off mute. Feel free to go ahead and do that. Okay, excellent. If folks who have done connections, if you have any sort of tips for others on like connecting with your WIC agency, or how do you refer families, would love to hear some of that as well. All right, thank you, Nancy. Yeah, that's helpful to hear. It's interesting, as we've been talking through with the network over the years, WIC is often the program that people are like, yes, our families are, a lot of them are connected with WIC, which is always really wonderful to hear. Alicia.
And in Massachusetts, we have invited the some echo. I'm sorry. We have invited the kinship, the grandparents raising grandchildren individual who is based in Massachusetts to our meetings to kind of talk a little bit more about how we can continue to support families and refer them to work. So it's a great partnership that we have in Massachusetts.
That's awesome. Thank you, Alicia. And I see from your info earlier that you are WIC. Love having you here, and great to hear that that connection is already there. So if other folks are looking for a way to connect, that is a great model. Thank you. Ro, one more click, please. All right, so this is related to that. Do folks have a relationship with either your local WIC agency or with your state WIC agency? I love this. Okay, Colleen is mentioning in the chat connections with WIC events and Grandfamilies Raising Grandchildren Commission, connecting for resource fairs and conferences. Wonderful. And Patty also works for WIC. Love seeing the WIC representatives here and the nice referrals there. And I think if you're working for a grand family focused organization, it's a great way to connect with WIC. And then if WIC ends up getting a grandparent or a kinship caregiver who hasn't already connected with you, you can make that two-way referral pathway as well. All right, we have a specific question on verifications. So one of the things about WIC is that if you've seen one WIC, you've seen one WIC. So there is going to be a little bit of variation. So in terms of verification, you'd need to provide either adjunctive eligibility through like showing your Medicaid participation or income eligibility documents. For kinship, you're going to need to show that you are in care of that child. What that looks like might vary a little bit, so I would definitely recommend connecting with your local WIC agency and figuring out like what are those go-to documents that they would require in that situation, and if there are opportunities to streamline that or communicate that information more widely, that'd be a great chance. And also, if any of the WICs on the call today want to drop in like the type of documents that they usually require, that could be really great to have a learning from that as well. All right, row one more, thank you, perfect. And have families you work with encountered challenges in accessing WIC? All right, I'll let people sort of mull on that question while we move on to the final discussion question. What resources, training, relationships, or other supports would be helpful for connecting your families with WIC? All right, like Clarissa, I will grab these questions and pop them in the chat in case anybody wants to follow up as they think about them. But beyond that, if we can move to the next slide, we'll open it up to general questions. So what's on your mind about these programs? Or if folks want to share learnings or ideas, would love to hear those as well. But I'll turn it over to you all. And I believe Melissa might be doing some moderation for us as well. Thank you.
Feel free to put your questions in the chat, or you can also just unmute yourself, but I will kick off. We actually had a couple people, when they pre-registered, put a couple questions in the notes, so I'm going to start with those. So Susan, I know you talked about WIC eligibility for kinship families, but somebody was asking about whether fictive kin are eligible, and I think all the things around like having legal guardianship, like for those that are inside or outside child welfare. I don't know if you know the answer to that question.
So legal guardianship should not be required for getting WIC benefits on behalf of the child. They will have to show that they are caring for the child in some way, and like I mentioned, that documentation could vary based on the local WIC agency. The other piece to keep in mind around that question is about household income, because they're looking at the household income for the eligibility, and typically that's all the members of the household, whatever income they have coming in. But if you have a situation where the child's in the legal custody of the child welfare system, and apologies if my language on that is not quite the most up to date, but there is that child could be considered a household of one for income in those sort of situations. And again, I'm going to lean on if folks from the WIC space are on and have additional guidance or details around how you all process that. It's always helpful to see that local implementation versus kind of like the big picture guidance on it.
Okay, great, thanks. And then someone else asked, I think you touched on some of this, but and I think you were trying to get this from the audience, but what are some common barriers that exist for kinship families who apply for programs like WIC or the Child and Adult Care Food Program, aside from, of course, eligibility? Like if you're eligible, maybe what are some of the common barriers that are existing to kind of go from the point of eligibility to actually getting access to the program?
I can start. I think for CACFP, the biggest barrier is really around are do they have access to the childcare, right? Are they going to a childcare center or a family childcare home? And then really are they participating in this program? And then after that, I mean, it's the reimbursement models for these programs are very confusing, or not confusing, but a little bit complicated as far as like how they get that reimbursement. So, but on the side of the families, it's really not. So I think the key piece with CACFP is just, making sure that wherever children are spending their time in childcare settings, that they are participating in CACFP. And I'll turn it over to Susan.
Thank you. Yeah, on the WIC side, a lot of it is around navigating the system, first finding out that WIC is an option. Because if you've heard about WIC and you're like, okay, that's for pregnant people, that's for people with new babies, for parents, I think there's a lot more awareness now for other caregivers and being able to apply for the program, but it can be confusing or there's knowledge gaps there. And then there can be a lot of steps when you're applying for programs, especially if you've just taken in the child and you're trying to navigate all of these different pieces around care, particularly when you weren't expecting that. So having information at the ready about how you can connect with WIC can be very helpful for navigating that application process. And then WIC agencies or nonprofit partners can also help families navigating using those benefits. Because with WIC, as I mentioned, there's specific food package items. So sometimes if you're not as familiar with the program or depending on the store you go to, it can be a little bit harder to navigate that and pick out the size item and the brand that goes along with your food package benefits. So I know some WIC agencies or nonprofit partners do like store tours, or they have shopping apps for WIC that help make that process a little bit easier. And then thank you, Alicia, for mentioning you use the Medicaid portal. So that's a really great practice that a lot of WIC agencies are able to use portals that they have access to complete some of the eligibility. So like you can look at, okay, this person's in Medicaid, I can pull in their address, their name, their income verification information, and then the person doesn't have to provide that again. They've already provided it for Medicaid, it applies for WIC. That streamlines the process, which is a really great practice.
Yeah, that is great. Wish there was more of that on all the benefits programs. So Jesse put in the chat, an issue we've noticed in Tennessee for kinship care is that caregivers are losing access to WIC, SNAP, and other programs due to receiving the caregiver stipend through the relative caregiver program. I don't know if this is something that's familiar to you at FRAC, or if there's any question, like a follow-up question to Jesse about that, or if there's other people in other states that are experiencing the same issues.
Yeah, that's not one I'm familiar with, so would love to learn more about that program, both to see if that's about like an education gap that needs to be remedied, because it shouldn't be applying, to see if it's something across states. But then the other thing I would urge you, Jesse, if I'm not sure who you are with, but if you haven't connected with Tennessee Justice Center before, FRAC works with them closely, and they're a really great resource to help folks navigate those kind of situations and figure out systems fixes as well. So would love to connect and learn a bit more and see if there's a way we can remedy that, and just get up to speed, and then also loop in TJC to help on the state level.
Jesse, I don't know if you're able to unmute yourself, but I'm assuming it has something to do with it puts them outside the income bracket to qualify.
Yes, it almost like makes it as a portion of their income instead of like
Hmm.
it's also a benefit that they're receiving. So a lot of them were getting cut off of things because they were receiving help from us.
Yeah.
Yeah, I think that'd be a good one to dig in to see if how it's coming through and if it should be counted as income for those programs, or if there's another way to provide that support for them that wouldn't be counted as income so they don't hit that cliff of benefits.
Susan, oh, perfect. Jesse, they put their emails in the chat, so please reach out because that is something that would be helpful to dive into a little bit more. I'm sure this is impacting other caregivers in other states as well. And then we had a question from Deborah on how do you reach to seniors seeking little ones under the age of 5? So really, how do you reach seniors about these programs?
Great question. I think for your community, the ideal is knowing how to reach seniors in that respect. So if you have really active Facebook communities or other social media, it can be great to share WIC information there. Like I showed the example from New York, Hunger Solutions New York, and I believe their materials are all available, and I don't think they have state branding. So those are ones that folks can borrow and use those great resources that they've developed. Anytime you can, of course, tailor the photos, the messages to highlight that these programs are available for caregivers to apply for the kids in their care. I think that's really wonderful. And of course, any like community center programs or older adult programs. And if you don't already think about them like creatively, like are there exercise classes at the local community center where you notice there's a bigger population of older adults using those? That could be a really great one to be promoting there. Or if you can partner with local grocery stores and post flyers that say, hey, are you a grandparent or a caregiver? That can be a great one. Yeah, Denise, absolutely. Looking at pre-K programs or libraries. So really anywhere that folks are going to come across that information, and you can really put out those key messages about, hey, there's a resource here. Here's a spot to learn more about this program. It's available for kids up to age 5. That can be really helpful.
Yeah, and also you touched on this, the area agencies on aging in your local community would be a great place too. And it's a good point because, you wouldn't think that area agencies on aging are talking about WIC programs because they're really always thought of to be, for pregnant women or for children, so it is a good point. They're probably not reaching those, but yeah, area agencies on aging would also be a great place, but there's some really good ideas in this chat as well. I want to see if there's any other questions before we wrap up. If you want to put anything in the chat or just unmute yourself. Thanks to all of you for those suggestions. Those are good. Before we close, I want to ask my colleague Ro if you could put a short survey up, and if you would just take about 60 seconds or so to fill that out, we'd so appreciate it before we close. And while you're doing that, my colleague put in the chat that we have an upcoming webinar on kinship care, what the research tells us. We are doing that in partnership with Chapin Hall, and we would love for you to join that. It's not heavy duty researchy. It's really about practical research and what that's telling us and how you can use that in your practice. And we'll keep this poll open for a few minutes, but I would like to thank Clarissa and Susan for both joining us today and sharing their expertise. I always learn so much. And if you need any technical assistance around food and nutrition programs, we can tap into their expertise. So you can go on the chat. You'll see a link to request no cost assistance, and we will connect you with them and all their wonderful resources. And I want to thank you for joining us today. Thank you so much, Clarissa and Susan. You are amazing.